My name is Rick Murdock. I'm Executive Director of the Michigan Association of Health Plans. Michigan's health plans provide health insurance to nearly 9 million people in our state. In today's world, health insurance is essential, not only to provide access to needed health care services, but also to prevent the financial burdens that may take years to recover from or even lead to bankruptcy. Unfortunately, we still have over 1 million Michigan residents without health insurance, and the need for affordable health insurance coverage is more important now than ever. When the cost of an uncomplicated birth can be $10,000 to $15,000, and a complicated birth can cost hundreds of thousands of dollars, when treatment in emergency rooms can be thousands of dollars, when routine surgery such as hip replacement costs $40,000, or when treatment for a serious heart attack is hundreds of thousands of dollars, families can't afford to be without health insurance. The evidence is very clear. When those without insurance get sick, they often seek care in the emergency rooms, the most expensive place to get care, and many can't afford to pay their bills, leaving hospitals to try to collect bad debts by raising the price of health care for those who do have insurance. We now estimate that as much as 1,000 of the overall annual premium paid by Michigan families is due to uncompensated care provided to others who do not have insurance. Because MAHP member health plans also manage the state's health insurance program for low-income families, almost all of them poor children, single mothers with children, the disabled, or seniors, we are very concerned about the state budget. Today, about 1.9 million people are on Medicaid, an all-time high and directly related to our state's poor economy. When our elected officials and candidates talk about cutting Medicaid program, they're talking about cutting care primarily for the children and the elderly. Moreover, under federal health care reform and when eligibility expansion occurs in several years, 1 in every 4 Michigan citizens will be on Medicaid. Decisions made now will directly affect how coverage and access will be provided in the future. For these reasons, MHP supports public policies that encourage and enable the uninsured to obtain affordable insurance and supports programs and policies to help those who cannot afford insurance, including those on Medicaid. That is why it is so important to vote in this year's election. It will be our next governor and his appointees who will regulate and administer health programs. And it will be those elected to the Michigan legislature who will make major decisions regarding the cost of health care, access to health care, and how it will be financed. As you talk with candidates in the months ahead, ask them if they support adequate funding for Medicaid. If they say they want to cut funding, ask them which benefits they want to reduce or eliminate, or if they realize that cutting Medicaid funding will mean higher health insurance premiums for employers and families around the state. Those of us in health care realize there are no easy solutions, but pledge to work hard to collaborate with our other consumer groups and health care providers to provide coverage options. We hope that our elected officials will equally work hard to assure that such accountable and affordable health care will be available for all Michigan citizens. You can learn more about Michigan Association of Health Plans, insuring the uninsured, and Medicaid at our website, www.mahp.org. Thanks for taking the time to learn a little more about MAHP and our need to provide access to affordable health care. And don't forget to vote.